So we see, this is a banana tree. You see the hip here is a banana tree. It's called the Siamese banana tree, or a banana plant. There are many different types of bananas. For example, bananas. Banana cow tea here, old banana cooey here. Banana cow man. And this is called the Siamese banana tree. The Siamese banana is called a porcelain banana tree. The part we use is the old Siamese banana. And we are the breasts, let it ripen. I would like to introduce you to a medicine. Stroke and accident prevention. This disease, gentlemen, there are a lot of people over 30. Maybe you're sick and the past days, Buddhists send a lot. Email or text message to ask. The preventive and curative medicine. Emergency care for people with stroke and accident. So I would like to introduce you to the post today. This medicine, and you will follow me to make this medicine. Is that so? I didn't use another banana. We used the porcelain banana. There's a banana pot here, it's aging. And we will harvest this banana. And he's ripe, and then we'll use it to make this medicine. Here to bring down this banana tree, gentlemen. Because it was too short, right? Dear fellow Buddhists, the ingredient we're looking for is Siamese bananas. The Siamese banana that I had, down. So I'm harvesting this Siamese banana. I brought my breast, and then it ripens like this. It's ripe like this, Siamese banana. This Siamese banana is called the porcelain banana, the raw material of Siamese bananas. 1.5 kilograms is 1.5 kilograms of Siamese bananas. It's about 20 bananas just like this. I weigh it about 1.5 pounds or 6. I said about 1.5 pounds. It's about 18 to 20 bananas like this. Monday is lemon. We're 1 kilogram. Then there's the third. Yes, I use sugar. You see, here's the hip. We're using alum. Here's the sugar. Let's break it. It doesn't have to be broken. It flows out. Here's the sugar alum. Here's the sugar alum. And now that we have all the ingredients, now I just cut the lemon in pieces. We cut a layer of lemon, a layer of bananas, and a layer of alum we put in. 1 kilogram of lemon, 1/2 kilo of bananas, and 1 kilo of alum chips. If we put it like that, we will cut out. But the hips need to be thin. It's just a thin lemon. That's an example. So this doesn't have to be too thin. That's how I cut it. Give it fast. Notice we also cut piece by piece here. You don't have to cut it very thin. We put a layer of lemon and a layer of banana in it. Then I put a little sugar in each class. Every class is like that. Just give it out. Who had a stroke or had that stroke? It's the same disease. But I think it's two diseases, and it's the same disease, because of the A's. What? A blood vessel in my brain. A Asian is choked at anemia pumped up. 2. It's broken. We call it a cerebrovascular rupture. The third thing is that it's broken. For example, there are AS, a fat clot, or fat and blood fat. It has 3 groups. The first is blood lipids, group 2 Asian triglyceride blood. The third group is cholesterol. These 3 groups, it's going to be called. That's the fat that's in the blood. So when I want to, that limits this fat. Don't let it choke your blood vessels. I have to break the blood fat. If you want to melt the blood fat, you can go to the A. If we talk about blood fat, we will. To listen to the cards that way. Or we've been drinking dandelion tea every day for years. Small package, it also melts blood fat. Or us, use a variety of other folk methods, especially when we do sports. Then it melts your blood fat. It's always on your hips. That's why I don't exercise. You have to sweat to practice a certain subject, and don't eat too much fat, especially noodles that eat too much every day. Breakfast, lunch, 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 it's also hip. Good. At night, don't eat at all. I ate some fruit, and my hips moved that night. I open up a lot of organs. Don't eat until 6 to 7 at night. If you eat too much fruit, you can't. That's why you have to. We know that so we can avoid it. The cause. There are many causes to cause. I don't eat much, and I eat a lot of fat. I mean, too much salt means too much salt. It means that there is too much salt in the blood. Anything you can't control, open your blood. It's high and blood is high. Many other reasons. It makes my blood pressure is going up. So I can't have it's controlling it, so it's breaking the circuit. That if it ruptures, it's on my brain. That's the whole area. It doesn't supply blood. The brain is there. That area is dead. The brain there, it commands all of its body. It's called a stroke. That's what it means. That emergency means that the disease is immediate. The disease is in place. Then the second A is that if that blood vessel goes up to your brain, that it inserts a certain nerve. And if it does, we're paralyzed by 500,000 people. The sign of a cataclysm. Or that stroke is usually when we open our eyes. I have tinnitus, a distorted mouth, or that people are very sluggish and tired. And there are headaches, one after another, sir, etc., or we are numb. A facial area, an area of the lips and so on, or hand and foot twitching, or half paralyzed, and so on. They're all signs of the cataclysm. Or a stroke. The most severe is acute, which is a mild stroke. Is that its cataclysm? There is still a disaster. The accident is to leave the consequences later. For example, people who are paralyzed can't walk, or AOVA. What part of the brain does it command? That part is paralyzed like walking. A is either movement or thinking A and so on. It has a very big impact. So ladies and gentlemen, yes, the circumstances in which the cataclysm we see happens, then we can use emergency methods to lower your blood pressure. If you are an architect, I will show you how to celebrate. Save the people disaster. Paralysis of a person or a deformed mouth, or being numb on one side, or hypertension to high, or shrinkage of limbs, and so on. We can be first aid. Stay at home before we drive to a hospital. Don't carry it immediately. In those cases, you don't have a windshield. The wind is heavier. Let the patient lie still. Okay, we'll call an ambulance. Or suppose I'll be somewhere far away. I can be an emergency at home by a number of methods of folk. Let's lower the pressure. If it's blood pressure, it's not blood pressure. My family will use a few. What a method that emergency about ritual injection and so on. So now you Buddhists are. Send mail, send phone poetry. Send messages continuously to ask about preventive measures and maybe. It's an emergency for people who have a stroke. Yes and no, this is a medicine to prevent a stroke and a stroke. It is very effective. This post has to be for 2 days. We have so much we pour in. You didn't pour water. This one is no spillage. Or not just right. I finished it and left it there for 2 days. Just close the lid so you can normally stay in your house. Here we are done. I'll show you the first aid of the Sika accident. You see the sign. It's a mouth contusion or a partial paralysis. Or maybe people have spasms. And so on, we emergency with the Kim tree. So my clothes, or this is a needle called a needle. A needles for sale at that pharmacy. Then we leave it at home. And so on, this Kim is number to fad, or the number 23 is okay. That is, when. In the case of people who suffer accident that paralyzes a half person, hip blood pressure down there, it's under the hood, that is, under the bottom part of a. That's my ear hole. I put this in. Then I squeezed out a drop of blood on one side. I have heard that people will affix the one that's half paralyzed or numb. One side of the face aches, one side of the head, and so on. The way to hold Kim. Let you always aim when you don't dare to do it. This is an emergency I just did, but normally you don't do it. I practice every day. I'm training on this Leo melon. For example, here, that's my hand. I see the hip to get in here. I have the technique of holding Kim here. And me when I put this Leo melon. Don't think I stung it. This is the arm, like the end of the hand. I put my hand in and here. I think I jumped. I jumped up and it's stuck here. It's attached. How you see my hips training here, I think I jerked up. I thought it would have a hole. We're done. We're bleeding. We're bleeding. I have to say, I have to go in here. I heard the hip had to go in. For example, I want to sting this place. The hand patch ends with that hand patch. Hey guys, you see the hip, you see the needle's nose, it goes down the hip. It means if you push it up, it will go down. This is the way we hold Kim. Kim is holding from the thumb with the finger. You can see that the hip is holding the needle and these 3 fingers. The rest is to probe where I need to inject it in the picture. Then I keep it. The hand is where I started the injection. And then I pump blood, and I prick that blood, and I prick that blood. I thought in my mind that I would jump. So this is how we adjust. That's how I lit Kim. How to needle. This is an emergency about stroke or hemiplegia or shrinkage of limbs. If you have a limb, 10 fingers. You guys have to hands. Fingers up here. That's the head out there. That's the finger. I pricked the needle lightly. I squeezed out a drop. Blood is 10 fingers. 10 drops. That person shrinks. They will wake up right away. And the person that, half paralyzed and so on. Then we inject 2. The earlobe at the bottom weighs a drop of blood. Just give you instructions here. Is when we're far away from the hospital. It can't be brought to the doctor. Then, you can help the patients with this folk way. You shouldn't abuse it this way, because we don't have the technology. And now it's me. If anyone wants a workout, that I'm in a remote frontier, that remote island, you take the gourd, melon or Leo melon. I hold Kim here, I practice here, I practice here. That's me. If you push this needle, it has to be perpendicular, with a face that I need. Go to that Kim, you see that hip, lift up the needle, put the needle up. When I pulled Kim up, he stabbed Kim down. The needle goes up and down. I practice like this. Let him get used to it. The technique that I use to draw blood is this. For example, The tip of the finger, I squeeze it in. Light up and the meat in the middle is heavy. It's bleeding. 1 drop of blood is enough. And the one Kim remembered holding this way. Hold the needle this way. I want it up, I don't want it down. When I pull it up, the needle jumps down. It's light, it's light. The needle is 2 or to be A. Where are you? Near the hospital, near the health station. You take the patient there, which in some cases is stroke. Accident, gentlemen. It shouldn't be wind shaving. Hips get wind shaved and hips. Move the patient a lot. Let the patient lie down. Breathe your nose and mouth. Take a deep breath and breathe out. Get enough blood to pump A to the brain. And us. If you don't dare to inject, we will use reflexology. We press 10 fingers. Here are 10 fingers. Press 10 fingers, 10 toes. Click on the corner. Click here to hands. And at the same time on my ear. Press the lower arm and press the ear ring on the top. Go up and click on the middle. As under the tip of my nose. Layer lemon, layer banana, layer sugar, alum, layer lemon, layer banana. Alum, sugar, layer. Lemon, banana, and finally sugar, alum. I put it on and cover it. Do not let water in for exactly 3 weeks, 21 days. The house is full of water. We just took that little comma, guys. The small common, but the common. People drink that tea. We drink together. You can drink it all the time, ladies and gentlemen. I drink 1 day together. In the same day he will make his vessels. It's tough up. It's hard to break. And it could be balancing blood pressure. And at the same time, it can melt bad blood fat in my body. If you are older, you should care. And this song, Harmless, means it's very benign, so there's no side effect. And don't be afraid. If we drink on a common day, we can take a preventive approach. It's your hips. This is a preventive measure. Who is affected? It's blood pressure. And so on, we must also be. Take blood pressure pills daily. Here we are preventive. Make your vascular system strong. You can balance a few. Simple of blood pressure or soluble. Blood fat and for me will bring it's a life. It's very, very healthy. And if you regularly do sports, sweat and will get enough sleep. And eat some fried food, fried and greasy. Drink less beer, no. Smoking, and so on. Especially people with heart disease and diabetes. We also have to be careful. Take medicine for regularly to prevent this stroke and stroke. Stomach, I wish you always a healthy life. And it's always fun. Live peacefully in the light from the 10 directions of the Buddhas. The master like C.A. Manu and I Buddha.